everyone. Thank you, Lee Kang. Okay. Before we get into our today's topic, if you want to refer back to my sharing about the immune system, you can, and our blood circulatory system and cardiovascular system, you can refer to the ELKEN Story YouTube channel. So as we're talking, today we'll be talking about musculoskeletal system. So as we're talking about the musculoskeletal system, there are some common problems that we might face. So actually, our bones and our muscles works together. So therefore, our bone problems is closely related to our muscle problems. So this includes having fragile bones, which is also known as osteoporosis, something that everyone is more familiar with. Some people might also have stiffness, which is something that many elderly people have. But actually, even young adults now would be experiencing this problem, as we would be sitting down a lot. So these problems started to occur among the younger generation as well. The next one is joint pain. And this one is really common, as it would affect our daily routine, our lifestyle. As for the fifth one is muscle weakness. So our muscle works with our bones in order for the motion to occur, right? So a weak muscle might be because of a lack of workouts, knowledge, or maybe their nutrient intake and our lifestyle. So the last one is something that many would have, which is cramps. So this doesn't occur just among pregnant women, but also for those who sat for too long, especially down at our calves. So many would think that cramps is due to that is derived from our muscle, but actually it's because we lack enzymes, which would cause our muscle which will strain our muscle and would cause muscle cramps. Those who lack enzymes would also have insomnia or other sleep problems, maybe anxiety and even constipation. So now, before we get into why these happens and how to resolve them, let's have a better understanding of our skeletons. So many knows about having fragile bones, but how does it come about? So first of all, we all need to know that our bones changes throughout our lifetime. They're constantly in a state of remodeling. So what is remodeling? So actually, every day, our bones will start from a large structure and decompose it into a smaller structure. And later on, it will reformulate into bones again. So this remodeling is occurring every day when decompose it and formulate again. And so why do we have bone loss or osteoporosis? Well, this is because during this process, the bone decomposition rate is faster than the bone formation rate. So when decomposition quickens up and formation slows down, your bone would start looking something like in this picture, where the density becomes lower as it is composting too quickly. So this is the cause of fragile bones and osteoporosis. So therefore, we need to have our bones to form quicker than it decomposes, or find a balance between the two so that our bones maintains a healthy level. So actually, many elderly people have perhaps like these kind of problems. That's why they are not able to take care of themselves. So if the osteoporosis is at our lung parts, it is actually really dangerous. And if it's at our back, our spine, it would cause us to have a hunchback. And if it's near our intestines, it will cause constipation. So here are some factors that would lead to fragile bones. So the first one is age, which is something that is beyond our control. But so sometimes we would say that it's because of our diet too. But actually, if you drink too much coffee or a lot of sodium, you would have a weaker bone as well. So if we want to have stronger bones, we know that we need to replenish on calcium. But actually, we also need to exercise, because when we're exercising, perhaps like running or jumping, it's actually putting pressure on our bones, which stimulates the formation of higher density bones. So another one is something that we can't control, which is our genes. So our genes, some of the genes might have a lower bone density. So it would cause a lower bone density. So I want to let everyone know that as for gene, you might have these genes, but that doesn't mean that you can't change that. So if you know you have these type of genes, you should try to prevent this from happening through diet or exercising so that you can decrease the risk of getting these problems. So another one is menopause. So after women had gone through menopause, like what our sharers had said, their estrogens would decrease. And in return, this would increase the occurrences of bone loss. So what the sharer said was really accurate. So you should be replenishing on calcium and strengthening your bones since you're young, before you experience menopause. So the next one might be because of other underlying diseases, some that might be related to hormones, and missing certain hormones might lead to more fragile bones. So some might be because of other illnesses such as diabetes, which has a close connection with osteoporosis. Others might be because of stomach problems such as inflammatory. So all of these will lead to weak bones. Because some stomach problems would weaken the absorption. So those with weak bones would usually have a weaker muscles as well. Because if you do exercises and you have a healthy diet, you wouldn't be lacking on muscles. And as muscles is in connection with our bones, have a weak bones too. So the first question, how does Comex help to maintain a healthy musculoskeletal system? So what should you do if your diet can't reach this recommended dosage, this recommended intake of calcium? Well, first of all, let's look at what type of calcium. First of all, we need to understand that the general calcium supplements are non-ionized. For example, calcium carbonate, one type of calcium that is most commonly seen and the cheapest. So as for calcium, it's not non-ionized calcium, it's ionized calcium. And it's something that uses the technology of electrolysis to produce the ionized calcium. So the ionized calcium are readily absorbable, which means that it is very easy to be absorbed, and it can be directly absorbed by our small intestine. And its absorption is also at a high rate of 97.4%. So having good absorption is also advantageous as it reduces the burden of our stomach. And as compared to general calcium supplements, they have less absorption, perhaps less than 50% or some 30%, because they are non-ionized calcium, where their absorption is only at 27% to 40%. So because like general non-ionized calcium, especially the one mentioned earlier, calcium carbonate, it would those who consume this will get really uneasy in the stomach after consuming them. And this is because there is too high of a percentage of be absorbed by our stomach and would remain at our small and big intestines, which would cause discomfort in our stomach. So therefore, it's really important to know what type of calcium you're consuming and whether the absorption is good so that it's less of a burden for those with weak stomach. So the second one is that Comex contains both calcium and magnesium, and it has a perfect ratio of 2:1, which is recommended by clinical studies. So why is it a ratio of 2:1? Well, this is because magnesium helps with the transportation of calcium throughout the body. It acts as a delivery man to deliver the calcium to where your body needs them. So many would mistaken that if they want to strengthen their bones, they should only replenish on calcium, which is wrong, because even if you have sufficient calcium, but you don't have the magnesium to help you transport, you won't be able to achieve maximum results. So when you're choosing supplements, if you want to strengthen your bones and increase your bone density, you should check to see if it contains a perfect ratio of 2:1 of calcium and magnesium. So the third one is the source of the Comex, which comes from oyster shells. And they're not like any other typical general oyster shells because they're premium oyster shells from Japan that are free from pollution and heavy metals. So other calcium supplements usually contains 80% of synthetic substances and only 20% from natural sources like general typical shells or animal spine. But for Comex, it comes from carefully selected premium oyster shells from Japan. So second question, why does arthritis develop? Because many friends experiences joint pain, and how can Cell Joy Go help? So first off, let's have a look at arthritis. Actually, a lot of friends would tell me that they have joint problems and stuff, but I really want to know what type of arthritis they have because there are many types. So I'll be picking out two of the most common ones. The first one is osteoarthritis, which is a type of degenerative arthritis. So joints are what that is connecting bones to bones. Our joints have cartilage, which acts like a cushion in between our bones. If our cartilage starts to wear and tear, maybe due to some repetitive motion, your age, or due to our lifestyle, it would cause our cartilage to degenerate and decrease. So without the cushion, our joints would hurt and become stiff due to certain motion, which would decrease joint mobility. So this is usually onset after exercising, as you will be using it a lot without any cushion to protect your joint, which causes inflammation or pain due to friction. So this osteoarthritis only occurs in certain places. Maybe if you use your knees often, so after exercising, your knees would hurt more. And so this would occur at specific particular places. So the next one is rheumatoid arthritis, which is caused by another factor. And it occurs because of our autoimmune and inflammatory diseases, which happens because our body, when our immune system attacks our healthy cells in the body by mistake, causing pain, swelling, and stiffness, and not just in one joint, but several others as well. And it would all come together. So this symptom can develop suddenly or gradually, accumulating and when it becomes worse. So it might build up slowly or it would develop suddenly. So Cell Joy Go, how does it help? Well, it delays joint degeneration and it can decrease joint pain. There are three major benefits. The first one, now let's look at how to inhibit, how to replenish, and how to reduce. So there are two main components. The first one is Curcumin Extract. So both are not like other common extracts as they are patented. So the curcumin extract is extracted using patented phospholipids coating technology, which makes it 30 times higher in absorption than normal curcumin. If you had heard about the analysis I've given on one of the past episodes, curcumin or turmeric itself is more difficult to absorb. So therefore, it needs these patented phospholipids coating technology to increase its absorption. And if absorption is good, the effective would also increase too. So therefore, because of its special technology, it's different from general curcumin extract. The second one is collagen type 2, which had also gone through patented technology to produce small-sized molecules to ensure fast and effective absorption. So sometimes so now let's look at some of the clinical studies. So now let's look at the patented collagen type 2 and its clinically proven effectiveness. So the first one says that Cell Joy Go can effectively inhibit joint deterioration. How do we know? Well, because of the clinical studies, those who replenish on collagen type 2 can inhibit hyaluronidase activities by up to 88%. So this enzyme would break down the hyaluronic acid in our body, but we don't want that to happen because hyaluronic acid can help to moisturize our joints. It can effectively inhibit hyaluronidase activities. This means that it decreases the chances of enzyme destroying the hyaluronic acid. So clinical studies also show that it can replenish on collagen type 2. Control groups that replenish on collagen type 2 can increase the production of collagen type 2 by 2.5 times. So this can actually help in replenishing on our cartilage. So the third one, increasing on collagen type 2 can also help in replenishing the hyaluronic acid in our body by 60-fold. As you can see, starting from day 0 to a month later, which is around 28 days, there has been a 60-fold increase in hyaluronic acid. So as mentioned earlier, hyaluronic acid can protect cartilage and provide moisturizing effect. And with that, it can slow down the degeneration of cartilage. The fourth one is reduces inflammation. And then this is because of the curcumin, as mentioned earlier, as it can suppress the symptoms of inflammation. So clinical studies, as we can see here, found that as compared to those who doesn't replenish on collagen type 2, those who does can significantly decrease inflammation by 94%. So with these 4 factors, the first one, we have said that it can inhibit joint deterioration. The second one is to replenish on lost cartilage tissue. The third one is to reduce inflammation and joint pain. Now, The third question and the last question, should I avoid calcium supplements if I have bone spurs? And this is something that I heard a lot of people have said because they will say that those with this condition should not replenish on calcium as it would increase the growth of bone spurs. So is this concept accurate? The answer is no. You shouldn't cut calcium from diet and supplement regimen in order to fight bone spurs. Why? We first need to understand how bone spurs come about. Bone spurs come about because that part has been wear and tear, usually from osteoarthritis, as mentioned earlier, due to long-term wear and tear. So in order to recover and protect your bones, it grows in the form of bone spurs, and it would stick out as it grew too much. So it's injured. So because your body wants to recover as the part of your bone has been injured, it would try to grow. Bone, but because it didn't grow as nicely, it would have the form of bone spurs, and it would be sticking out. So another causes of wear and tear might be derived from rheumatoid arthritis. As long as you have been injured and it has inflamed, it needs to undergo recovery. And this recovery process is what causes bone spurs. And third is because of autoimmune diseases such as lupus. And then there's gout, as it occurs because of uric acid, which accumulates at our joint, which causes wear and tear. And overusing, such as while doing sports, would also wear and tear our joint. Lastly is obesity, because our joint would have to withhold more weight. So therefore, having bone spurs is not because you have replenished on too much calcium, but because some parts of your joint were given too much pressure. That's it for my sharing. Thank you.
Wow, thank you to